Hi, Alex. My name's Coco. I'll be your LPN today. Can you verify your name and date of birth for me?
Alex 0128 1977.
Perfect. And what brings you in today?
My hand's just been kind of shaking. I've been having uncontrolled where I'm reaching for things. I kind of do like a pill rolling thing. I've been off balance. I've been very slow to move around. I go to smell things and I can't smell them as well. I haven't gone to the bathroom in like 3 days. I just can't sleep at night. My wife says I have like really bad mood swings. I've been tired, and when I go to stand, I collapse. I'm dizzy.
Okay. Well, let's go ahead and I'll get all this information over to the doctor. He'll come in, he'll speak with you, get your evaluation and everything done, and we'll move forward from there. So, do you mind just waiting in the office?
Of course.
Thank you. Hey, Doc. I'm calling about your 2:30 appointment in room 215.
Oh, yeah. Go ahead.
He has a new onset of symptoms suggesting Parkinson's. The patient is experiencing resting tremors, slow movement, and also shuffling gait that has progressed recently. We got the MRI back, and it's showing results indicative of Parkinson's, so I'll just have to have you review that for us.
Yeah, I'll do that.
Symptoms have gradually progressed since the last visit. There's no recent trauma, and he does have a family history of Parkinson's on the paternal side.
I remember that.
Yeah, and then I didn't see anything about any infections. His wife did report, though, he's been having some issues with fine motor skills. We also see here there are no known drug allergies, and his current meds that he's on are like CoQ10, his omega-3s, and just some daily multivitamins.
Okay.
As far as vitals go, the blood pressure, heart rate, and respiratory are all within normal limits. When I was doing the assessment, I did note some resting tremors observed in the upper extremities, indicating some extrapyramidal symptoms. He did have some bilateral rigidity in both upper and lower extremities, and then also he had some changes in gaits where I did not see any arm swing being observed while he was walking. He also has some stop posture as well. As far as mental status, he's alert and oriented ×4, and he does have some decreased facial expression. What I'm requesting is just a reevaluation of medication for possible Parkinson's. We'd like to go ahead and get a baseline labs to monitor the stage of progression. I'd also like to obtain a referral for physical therapy to address the gait imbalance, along with a follow-up with neurology and the psychiatrist for consultation. I will go ahead and provide the patient and family teaching of Parkinson's and also how to manage the symptoms, and then educate on when to call for emergency services.
Okay, yeah. We could definitely do all those things. I'll just go put those in, and I'll go see him very shortly.
Nervous?
Yeah. I'm one of the doctors here at the clinic. I'm here to prescribe you some new medication after going over the symptoms with the nurse.
Okay.
So, what I'm going to be prescribing you is going to be carbidopa levadopa. This is a dopamine antagonist drug.
Okay.
It's going to be dosed at 35 by 140 milligrams. You're going to be taking this drug twice a day. This is going to be taken morning and evening. You're going to be ensuring that you're going to be taking this throughout your progression of your symptoms. And you're going to be taking this as soon as you forget your medication as well, if you do forget to take your first dose.
Okay.
So some of the side effects that may happen when you're taking this drug is going to be nausea and also orthostatic hypotension. These are the most common ones. Orthostatic hypotension is when you get up too fast and then your blood pressure just drops, and then you might pass out or get lightheaded or dizzy. Okay, so slowly just get out of bed, get out of the chair whenever you are taking
Slow
this
and steady.
medication.
Okay.
Correct. There are some severe side effects that could happen with this drug. So some of the severe side effects could be an allergic reaction, hives, itchiness, anaphylaxis. If that does happen, just stop the drug, and just let me know. Another one would be suicidal ideations is a possibility, and mood changes as well. So just let me know if that is happening, and then we'll just adjust your dose from there. There is also a severe reaction that could happen where you are having difficulty specialty bleeding. So then you'll throw up blood or you have bloody stool. If that does happen, stop the drug immediately and go to the urgent care or ER as soon as possible.
Okay.
And some drugs that you need to be aware of that you're not supposed to take at the same time. That's going to be MAOIs, antipsychotics. Inform me if you are taking warfarin.
I'm not taking any of those.
Yeah. Whenever you are seeing another doctor, just make sure you go and bring the medication list as soon as possible.
Okay.
All right, so we can be able
So
to
both of you
review that.
guys?
Yeah,
Okay.
correct. Is there anything that you specifically need?
No, doctor. I think you kind of hit the idea.
Yeah.
Is this something I'm gonna have to take for life, or?
Yes, you'll have to be taking this for the rest of your life until the disease is cured, which we don't know when that can happen.
So, like, if I start to see something better, don't stop it. Just keep taking it.
Just keep taking it.
Okay.
And then also you'll start seeing the symptoms start going away within 2 weeks, generally.
Okay.
2 weeks is like most part. Some people see it as soon as 1 week, 3 weeks at the latest. But we're gonna be seeing you in 3 weeks, so we'll know what if it's helping. Yeah.
Okay.
If you notice like all your tremors and stuff is going away, then the drug is working. If you're noticing there's more side effects that are going on or it's still staying the same, then we'll know by that 3 week point, and then we can just change the drug from there. Okay? All right then. I'll see you in 3 weeks.
Yes, sir.
All right then.
Yeah.
Okay. All right.
All right, Mr. Alex, so I'm aware that the doctor has came in and spoke to you about the medication that we have you on. I'm just gonna kind of go over Parkinson's disease a little bit with you, kind of give you an explanation, so that way you kind of understand. So as you can see up here, Parkinson's is a chronic neurodegenerative disease that affects the substantia nigra, and it contributes to lowering the dopamine production. So basically, kind of think of it like engine oil. You know, your engine oil kind of helps you keep moving. Dopamine in this case is what's keeping your body moving. So when you have a decreased level of that, it causes...
It's like when my car has a leak and it's pouring out so it's almost like the metal rubbing on metal and not working right.
Exactly.
Okay.
So you'll kind of experience some symptoms here with Parkinson's. More commonly is noted are your motor symptoms, but you also have non-motor symptoms too. So just to kind of go over the motor symptoms with you, we have things like tremors.
So that's the uncontrolled movement I'm feeling.
Absolutely. Slow movement or bradykinesia in the medical world.
That's where I'm trying to go slow walking.
Exactly. Okay. You'll have things like stiffness or rigidity. It's just a little hard to move.
That's where I was feeling like my muscles were tight all the time.
Right, absolutely.
Okay.
And then also unsteady gait and balance. So whenever you try to stand up and walk, or
that's
you
why
know,
I
you
face
just
planted.
Exactly. That's exactly why that happened to you this morning. Also, like I said, you have your motors, but you also have your non-motors over here too. So you'll notice things like a loss of smell. Like
I couldn't smell my wife's perfume this morning.
Exactly. Or you'll experience symptoms like constipation.
Is that why I haven't been able to have like a bowel movement in like 2-3 days?
Absolutely.
Okay.
You'll also experience things as far as sleep disorders like insomnia.
That's why I haven't been able to sleep, and that's why my wife keeps kicking me out of the bed.
Exactly. You'll have issues with mood disorders, so, you know, 1 minute you'll be feeling okay.
That's why I've been feeling happy and then sad, and it's like I thought it was the weather.
Exactly.
Okay.
Some cognitive changes as well.
So would that be like, I was like trying to understand things, and it's like I just couldn't comprehend what people were explaining to me?
That, or it could also be that you understand and autonomic issues like orthostatic hypotension.
Is that like why when I stand up I get dizzy?
Absolutely.
Oh, okay. Oh, if you or a loved one does suffer from possible Parkinson's, we do have a helpline called the Parkinson's Foundation. It is 1-800-4PD-INFO. They will be able to help you identify the symptoms and the signs of Parkinson's. They will also help you with medication questions such as why am I taking this med, or when should I be taking it. They have an emotional support line, so that way when you're feeling down, they can help bring you back on up. They have a neurologist, so if you have a nearby neurologist, they'll set you up with appointments to go ahead and meet with them, and caregiver resources so they can try to help you get an in-home caregiver.